Absolutely. So testosterone is a big topic now, especially for young men, and rightfully so. Because we have technically a testosterone epidemic at the moment. And if you look at statistics, if you look
low
at
testosterone epidemic,
low testosterone epidemic in the last 20 years compared to decades prior,
really,
is that men in their age brackets are having lower testosterone than they did in the previous generations.
Really?
And there's a lot of factors contributing to that. Statistically, we know that increased obesity rates are largely contributing to that. Poor diets, increased stress in our lives, the influence of internet, social media, and all these things are contributing to that as well. Is this important? That's the real question. Does the number really matter? I think the real answer is it depends, because it is just a number. I have a lot of guys that come to me in my office and they're feeling great. Their sex life is great. Their exercise is great. Their energy is great. But their testosterone is probably not in the range of what's considered optimal.
Which is what? What are the range? Yeah.
So optimally, literature says that you should peak in testosterone around from 18 to 30, somewhere in that range. Usually teenagers are known to be very high testosterone. They're going through puberty and they're becoming adults. And that range, in that bracket, 18 to 30, your testosterone should probably be somewhere from like 600 to 800. Sometimes up to 1,000 is considered normal even. And then from 30 to 45, you can say 400 to 600, 400 to 700 is normal. And then 45 to 65, I would say 350 to 600. And then after, 65, 250 to 450.
So average testosterone levels reduce over time and as you age.
That's correct.
And then I got you a bit off track. So you're telling me, first of all, like every good doctor, there's no like broad strokes here as far as every individual patient is different.
That's right.
And just because your testosterone is low does not mean that is the culprit behind all of your symptoms and problems and complaints. Dr. Benhuri is presenting an example of a patient who is feeling well, robust sex life, high libido, and yet his testosterone might not be very high. It might be even low compared to the normal range. So testosterone level, it's important. Don't put too much stock in it. It is one metric, but don't put all your eggs in that basket. Is that fair?
That's correct. 100%. It's one piece of the puzzle.
Yeah.
Don't get me wrong. There's people who do suffer from low testosterone, and that's something that we should address.
Yeah.
And there's different ways to address it. But the overwhelming majority of the time, especially if you're a young, healthy male, if you have a low testosterone, it's probably caused by something else. There's usually nothing wrong with you.
Like what? What can cause low testosterone levels?
Great question. So traditionally, certain medical conditions cause low testosterone for people, including diabetes, thyroid issues, profound obesity. And there's definitely certain medications that lower your testosterone, especially in the psychiatry class of medications.
We'll put a pin in that and get to that later.
Which is very important for physicians to know. However, common every day-to-day things can really affect your testosterone.
Like what?
So, in the world we live in, there's tremendous amount of stresses in our lives, work stress, financial stress, relationship stress, parenting stress. This stress and pressure, which may lead to anxiety, poor sleep, poor appetite, poor diet, all of these together can affect your testosterone levels and are usually considered the main cause of your suboptimal testosterone levels.
Chronic stress, insomnia can lead to low testosterone levels.
Absolutely. The two predominant causes of low testosterone in a young, healthy male in our generation is chronic stress, poor diet, and obesity.
Fascinating.
By far. You could even argue obesity is probably number one.
What are some natural ways, without medications, to increase your testosterone? Let's say, okay, clean up your sleep, adjust your diet, try to address the stressors in your life, the chronic stress. Are there any other ways that we can increase our testosterone levels?
Without medication.
Without medications?
Absolutely.
Like what?
The number one way I would say is if you're overweight or obese, focus on losing weight. The reason for that is when you're obese or overweight, you have more fat cells or larger fat cells, and that promotes estrone. which is a hormone that's pro-estrogenic, and that can reduce your testosterone levels and decrease the function of your testosterone, which will lower your testosterone.
Okay, so in fat cells is some sort of enzyme, or there's something happening in fat cells that converts testosterone to estrogens? Is that what you're saying?
No, it's more the adipose cells, which are fat cells, that are in the body. If there's too much of it or too much abundance of it, it can promote a hormone called estrone, which could basically lower your testosterone levels.
Fascinating. So being too fat and having too much adipose tissue, which is fat tissue, can lower testosterone levels.
That's
so
right.
one way to increase your natural testosterone is by losing weight.
That's correct.
If you're obese.
Which goes to my next thing, which is exercise.
Exercise.
So number 1 is weight loss. Number 2 is regular exercise.
What kind of exercise? Is it like long distance cardiovascular exercise, weight training, interval training with intensity? Is there any evidence as to what sort of exercise will increase testosterone levels the most?
The most, I would say, definitely resistance training of your big muscle groups, like your quadriceps, your buttocks, your thighs, your chest, your back. Working on those muscle groups, putting stress on them will promote a testosterone boost. But you have to make sure not to overwork them either, because you can also deplete your testosterone if you overwork your body. So I see a lot of guys come to me, they're bodybuilders, and they're huge guys, like Arnold built guys, and they have low testosterone. And the reason for that is they're overtraining.
Or exogenous hormone use, but we'll get to that later.
That's true too. Yeah. That's true. You got to be aware of those things too.
Yeah.
So you got to make sure you hit the sweet spot when it comes to your testosterone. Make sure you're not undertraining or overtraining. An hour a day or an hour every other day is very healthy. And adding cardiovascular training is also very important too, which has an added benefit of cardiovascular health and mental health too.
Yeah,
so, which can help promote the testosterone as well.
Yeah. Now let me pick you up on something you said. Psychiatric medications that may reduce testosterone levels.
Yeah.
Can you speak on that?
Yeah, there's certain medications that patients may be taking for their psychiatric conditions that could contribute to low testosterone.
Like which ones?
Specifically, patients who are taking antipsychotic medications. So if they're being treated for bipolar or schizophrenia, you should be very mindful of what they're on. Newer generation or older generation antipsychotics can lower your testosterone. But even like some of the everyday medications, like even Seroquel, for example, for sleep, that can affect your hormone levels.
Yeah.
That you should be mindful of.
And if anybody has any questions as to antipsychotics and potential negative impacts on testosterone, leave comments below, and then we can link you with some more information, some evidence.
And another one is there are some medications used for heart failure, or they're used for acne.
Is there one classic example of a medication that people are taking that is reducing their testosterone they should be aware of? Is there one that stands out from the rest?
I would probably say like Risperidone or Risperidone, that kind of medication.
He's talking about an antipsychotic medication that one of the side effects has to do with prolactin and other hormones that regulate our sex hormones.
That's right. That's classic, I would say.
Yeah,
that's classic. But you don't see a lot of people on it, obviously.
Yeah.
But if you're in a niche, area, and there's a lot of patients who are on that, you should definitely be mindful of that.
Yeah, and antipsychotics like Seroquel, those have the potential to have big time metabolic side effects.
Definitely.
Which include insulin resistance, which include gaining weight, increased waist circumference,
leads to low testosterone,
gaining fat tissue, which of course then leads to an increase in estrogen and female sex hormones and a reduction in testosterone. Let's go on to the next topic.
It was a great topic. I love it.